started your recording and here is your question. Right, so if you have read and understood, considering its surgical anatomy patient, kindly tell me what image are you looking at?
And the image which is on the right side, which is labeled as A, is the dorsal view of the scapula, and the image B is the anterior view of the scapula.
Would you be able to identify which side of scapula that is by looking at just looking at it?
Yes, ma'am. This is the scapula on the left side.
Left side.
That's the acromion process. Yes.
Yes, good. Can you identify what is this number 2, please?
And that is the acromion process of the scapula.
If you can please identify number 15 here.
And that is the supraspinatus fossa.
All right. What attaches over there?
The supraspinatus muscle attaches.
It is innervated by which nerve?
Suprascapular nerve.
Okay. Right. What is here? 5. Can you identify, please?
That is the infraspinatus fossa. The infraspinatus muscle is attached.
And it is innervated by?
It is again innervated by the suprascapular nerve.
Good. 11, please, over here.
And that is the subscapularis fossa, which holds the subscapularis muscle.
Okay, good. Can you please tell me how shoulder girdle is formed? This is shoulder girdle in picture C. Can you please tell me how is it formed?
Okay. And the shoulder girdle is formed between the articulation between the glenoid fossa and the head of the glenoid cavity and the head of the humerus, and a joint between the clavicle and the scapula.
Okay. Can you please tell me what are the structures which are attached to the coracoid process?
There are 3 ligaments and 3 muscles at the coracoid process attached. And the ligaments are coracoacromial, coracoclavicular, and coracohumeral. The muscles, the pectoralis minor is inserted, and there is origin of coracobrachialis and the biceps brachii, the short head of biceps brachii.
Good. Right. Can you tell me how this shoulder girdle or shoulder joint are stabilized?
The shoulder joint is mainly stabilized by the rotator cuff muscles, namely the supraspinatus, infraspinatus, teres minor, and subscapularis.
Yes.
It is also supported by the glenoid labrum, which is a fibrocartilage structure outside the cavity, which strengthens the shoulder joint, and ligaments, that is the glenohumeral, coracohumeral, and the coracoclavicular ligaments.
Good. Can you tell me or mention few factors which decreases the stability of the shoulder joint?
Because of the disproportion of the head of humerus and the cavity, which is in the ratio of 1:4, the shoulder joint is highly mobile, but there is a risk of dislocation, as well as the sheer few number of ligaments and the laxity.
Yes. Yes. Okay, good. Can you please...
And the quadrangular space which is present in the anterior.
Very good. Okay. Can you please tell me, all right, you've already mentioned. Can you please tell me the boundaries of the quadrangular space?
The boundaries of the quadrangular space, the superior border is formed by the teres minor, the
Yes.
inferior border is formed by a teres major muscle, the lateral border is formed by the surgical neck of humerus, and the long head of the triceps by chimeras.
Medially. Okay, and anteriorly subscapularis. So what are the contents of quadrangular space?
The quadrangular space contains the posterior circumflex humeral vessels and the axillary nerve.
Okay, good. You just mentioned the muscles of the rotator cuff. Can you please tell me what are the functions of each of these four muscles, and these are innervated by which nerves?
Yes, ma'am. The supraspinatus muscle is used while abduction of the shoulder. The
Yes.
supraspinatus muscle is supplied by the suprascapular nerve.
Yes.
The infraspinatus muscle is an internal rotator of the shoulder joint, ma'am. Again, supplied by the suprascapular nerve.
Yes.
The teres
Teres.
minor is an external rotator of the shoulder joint.
Yes.
And the last muscle is the subscapularis, again an internal rotator of the shoulder joint, and supplied by the lower and upper subscapular nerve.
Yes. Good. Right. Okay. Can you, which out of these four muscles of the rotator cuff, which one is more prone to impingement or can cause impingement?
And the supraspinatus, yes, ma'am. The supraspinatus tendon is more common because of yes, ma'am.
Good. Okay. Can you please mention the tendons of the long head of biceps, which lies in the groove?
In the bicipital groove. Ma'am.
Yes. Along with something else?
Yes, ma'am. The floor is formed by the latissimus dorsi of the bicipital groove. The lateral lip is formed by the pectoralis major tendon, and the medial lip of the bicipital groove is formed by the teres major tendon.
Okay. Can you please tell me what are the range of movements which are possible at shoulder joint, and which muscles are responsible for those? Okay, begin with
shoulder
abduction.
joint.
Yes.
The flexion of the shoulder joint is
Yes. Please.
Okay, and the abduction of the shoulder joint is up till 160 degrees. From 0 to 15 degrees, it is carried out by supraspinatus muscle.
Good.
From 15 to 90 degrees, it is carried out by the deltoid and the teres minor muscle.
Okay.
And from 90 to 165 degrees, it is carried out by the serratus anterior and the trapezius muscle, which causes the upward rotation and the lateral rotation of scapula and humerus.
All right, good. Can you please explain the image you are looking at right now?
Yes, ma'am. This is a coronal image of the coronal view of magnetic resonance image of an arthrogram of the shoulder joint.
Good.
On the right side.
Yes. So would you be able to identify the circled structures? So
yes,
number one, please.
Yeah. Number one is the acromion of the scapula. Number four is the clavicle, and number 5 is the deltoid muscle.
Very good. Deltoid muscle is supplied by which nerve?
Deltoid muscle is supplied by the axillary nerve.
What is the root value?
C5, C6.
Okay, good. Can you please tell me what this arrow is pointing at?
The arrow is pointing at the glenoid cavity.
Yes. Okay, and what is this 7 pointing at?
And that is the glenoid labrum, the fibrocartilage structure.
Very
outside.
Good. Thank you. And then 10, please. 10 is here.
That is the supraspinatus muscle, tendon of the supraspinatus.
Yes. Good. Thank you.
Thank you.
Good. Okay, started the timer, and here is your question.